Hello and namaste to all of you. This is Name-Shalu Singh from Department of Physiotherapy and Diagnostics from Jayoti Vidyapeeth Women's University. So for today's topic, I would be discussing with you about CSF, that is cerebrospinal fluid. So cerebrospinal fluid is a clear, colorless body fluid found within the tissues that surround the brain and spinal cord of all vertebrates, and it replaces the body fluids found outside of the cells of all bilateral animals. So the CSF is produced by specialized ependymal cells in choroid plexus of the ventricle of brain and absorbed in arachnoid granulations. So there is about 25 ml of CSF at one time and about 500 ml is generated every day. So CSF acts as a cushion or buffer and provides basic mechanisms and immunological protection to the brain inside the skull. So, CSF also serves as a vital function in cerebral autoregulation or cerebral blood flow. CSF occupies the subarachnoid space between arachnoid matter and pia matter and the ventricular system around and inside the brain and spinal cord, and it fills the ventricle of the brain, cisterns, and sulci, as well as central canal of the spinal cord. There is also a connection from subarachnoid space to the bony labyrinth of the inner ear via the perilymphatic duct, where the perilymph is continuous with cerebrospinal fluid. Through the ependymal cells of choroid plexus, they have multiple motile cilia on their apical surfaces that beat to move CSF through ventricles. Now, a sample of CSF can be taken via lumbar puncture. This can reveal intracranial pressure as well as indicate diseases including infections of brain and its surrounding meninges. So, although the notes by Hippocrates, it was forgotten for centuries. It was discovered in 18th century by Emanuel Swedenborg. In 1814, Harvey Cushing demonstrated that CSF was secreted by choroid plexus. So there is about 125 to 150 ml of CSF at one time, and this CSF it circulates within your ventricle system of the brain, and the ventricles are a series of cavities filled with CSF, and the majority of CSF is produced from within the two lateral ventricles. From here, CSF passes through the interventricular foramina to the third ventricle, then the cerebral aqueduct to the fourth ventricle. From the fourth ventricle, the fluid passes into subarachnoid space, and through the four openings, the central canal of the spinal cord, the median aperture, and the two lateral apertures. So the CSF is present within the subarachnoid space, which covers the brain, spinal cord, and stretches below the end of spinal cord to the sacrum. There is the connection from subarachnoid space to the bony labyrinth of the inner ear, making cerebrospinal fluid continuous to the perilymph in 93% of the people. Now, CSF. So CSF moves in a single outward direction from ventricles, but multidirectionally in subarachnoid space, and fluid moves in pulsative, matching the pressure waves generated in your blood vessels by beating the heart. And some authors dispute that this posing that there is no unidirectional CSF circulation, but cardiac cycle dependent, bidirectional, and systolic, diastolic to and from craniospinal CSF movements. So, for CSF, there are various contents of CSF. So, CSF is derived from blood plasma and is largely similar to it. And except that CSF is nearly protein free compared with plasma and some different electrolyte levels due to the way it is produced. And CSF has higher chloride levels than plasma and an equivalent sodium levels. So CSF contains approximately 0.3% plasma proteins and approximately 15 to 40 mg per year depending on the sampling size. And in general, globular proteins and albumin are in low concentration in ventricular CSF as compared to the lumbar and cisternal fluid. This continuous flow of venous system dilutes the concentration of large lipid insoluble molecules penetrating brain and CSF. And CSF is normally free of red blood cells and most contain fewer than 5 white blood cells per millimeter cube. Now, at around third week of the development, the embryo is three-layered disc and is covered with ectoderm, mesoderm, and endoderm. And a tube-like formation develops in midline called notochord. And this notochord, it passes extracellular molecules that affect the transformation of overlying ectoderm into nervous system. Now, the neural tube forming from the ectoderm contains CSF prior to the development of choroid plexus, and the open neuropores of neural tube close after the first month of development, and CSF pressure gradually increases. So, as the brain develops, by fourth week of embryological development, three swellings have formed within the embryo and around canal near where the head will develop. Now, these swellings represent different components of central nervous system, that prosencephalon, mesencephalon, and rhombencephalon. Now, subarachnoid space are first evident around 32nd day of development near the rhombencephalon, and circulations is visible on around 41st day. At the time, the first choroid plexus can be seen around in fourth ventricle. Although the time at which they first secrete CSF is not yet known, the developing forebrain surrounds the neural cord, and as the forebrain develops, the neural cord within it becomes a ventricle, ultimately forming large ventricles, and along the inner surface of both the ventricles, the ventricular wall remains thin, and the choroid plexus develops, producing and releasing CSF. Now, CSF quickly fills the neural canal, and arachnoid villi are formed around the 35th week of development, with arachnoid granulations noted around 39 and continuing developing until 18th month of the week. Now, the subcommunal organs secrete SCO-spondin, which forms resonance fiber within CSF and assisting the movement through cerebral aqueduct, and it is presently in early intrauterine life but disappears during early development. Now, CSF, it performs various functions. So, first function is a buoyancy. So, the actual mass of human brain is about 1400 to 1500 grams. So, however, the net weight of brain suspended in CSF is equivalent to a mass of 25 to 50 grams. So the brain therefore exists in neutral buoyancy, which allows the brain to maintain its density without being impaired by its own weight. So which would cut off blood supply and kill neurons in lower sections without CSF. Now, second function of a brain is protection. So a CSF protects the brain tissue from injury when jolted or hit by providing a fluid buffer that acts as a shock absorber from some forms of mechanical injury. Now, third function is prevention of brain ischemia. So, the prevention of brain ischemia is added by decreasing the amount of CSF in limited space inside the skull. Now, this decreases the total intracranial pressure and facilitates blood perfusion. Now, homeostasis uh, is the next function and most important function, as the CSF allows for regulation of distribution of substances between cells of brain and the neuroendocrine factors to which slight changes can cause problems or damage to the nervous system. For example, high glycemic concentration disrupts temperature and blood pressure controls, and high CSF pH causes dizziness and syncope. And the large function is clearing waste. So CSF allows for the removal of waste products from brain and is critical in brain's lymphatic system called G-lymphatic system. So metabolic waste products diffuse rapidly into CSF and are produced in bloodstream as CSF is absorbed. Now, when this goes awry, CSF can be toxic, such as an amyotrophic lateral sclerosis and commonest from the motor neuron disease. Next is your production. So the brain produces roughly 500 ml of cerebrospinal fluid per day and at the rate of 25 ml an hour. So this transcellular fluid is constantly reabsorbed so that only 125 to 150 ml is present at one time at any one time, and CSF volume is higher on a ml per kg basis in children compared to adults, and infants have a CSF volume of 4 ml per kg and children have a CSF volume of 3 ml per kg, and adults have a CSF volume of 1.5 to 2 ml per kg. And this the CSF, it basically has a higher volume in on a ml per kg basis in children compared to adults, and infants have a CSF volume of 4 ml per kg. So most about 2/3 to 80% of CSF is produced by choroid plexus, and the choroid plexus is a network of blood vessels present within the sections of four ventricles of brain, and it is present throughout the ventricular system except for the cerebral aqueduct, frontal and occipital horns of lateral ventricle. And CSF is also produced by the single layer of column-shaped epidermal cells which lines the ventricles, by the lining surrounding by the subarachnoid space, and a small amount directly from the tiny spaces surrounding the blood vessels around the brain. Now, CSF is produced by choroid plexus in two steps. So, firstly, a filter from a form of plasma moves from fenestrate capillaries in the choroid plexus into interstitial space, with the movement guided by a difference in pressure between blood in the capillaries and the interstitial fluid. Now, this fluid then needs to pass through the epithelial cells lining the choroid plexus into the ventricle, and an active process requiring the transport of sodium, potassium, and chloride that draws water into CSF by creating osmotic pressure. And unlike blood passing from capillaries into choroid plexus, the epithelial cell lining, the choroid plexus, contains tight junctions between the cells which act to prevent most substances flowing freely into CSF. So cilia on the apical surfaces of the ependynal cells beat to help the transport of CSF, and water and carbon dioxide from the interstitial fluid diffuses into the epithelial cells, and within these cells carbonic anhydrase converts substance into bicarbonate and hydrogen ions, and these are exchanged for sodium and chloride on the cell surface facing the interstitium. Sodium, chloride, bicarbonate, and potassium are then actively secreted into ventricular lumen, and this creates osmotic pressure and draws water into CSF, facilitated by aquaporins. Chloride with a negative charge and moves with a positive charge sodium to maintain electroneutrality. Potassium and bicarbonate are also transported out of CSF. As a result, CSF contains a higher concentration of sodium chloride than blood plasma and less potassium and calcium, glucose, and proteins. So choroid plexus also secretes growth factors, iodine, vitamin B1, B12, C, folate, beta-2 metroglobin, arginine, vasopressin, nitric oxide into CSF. So sodium potassium chloride cotransporter and sodium potassium ATP is found on the surface on the choroid endothelium. It appears to play a role in regulating CSF secretion and composition. So there are circadian variations in CSF secretion with the mechanisms to fully understood, but potentially relating to differences in activation of autonomic nervous system over the course of the day. So choroid plexus of lateral ventricle, it produces CSF from the arterial blood provided by anterior choroid artery in the fourth ventricle, and CSF is produced from the arterial blood from the anterior inferior cerebral artery and cerebellopontine angle and adjacent part of the lateral recess. So the posterior inferior cerebral artery, roof and the medial opening and the superior cerebral artery. Now, there this was about whole about the introduction and the contents of CSF. Now, in further topics, I'll tell you about the clinical significance of CSF and also what is the significance of the contents present in your CSF. Now, until then, if you have any doubts relating to this topic, you can contact me. And until then, thank you and take care.